The federal government, in collaboration with some NGOs, have sought the active participation of the male gender to end female genital mutilation (FGM) practice in the country. They made this known during the 2023 International Day of Zero Tolerance (FGM) organized by the Federal Ministries of Health, Women Affairs and Justice under the USAID Momentum Safe Surgery in Family Planning and Obstetrics (MSSFPO) projects. Dr. Osage Ehanire, Minister of Health, described FGM as a human rights violation which had no health benefits but rather leads to severe bleeding, deaths, infection, complications in childbirth, amongst others.
The problem is not that it comes into the health facility where you can catch them, otherwise they will be sacked immediately. But the point is that there are people in the community, maybe some of you, who know where it's been done and you don't report. Those who see and know that is being done in that particular place and they don't report it, those are the ones you need to blame. So if you ask the Minister of Justice or the police, why are you not arresting them? The reason is that you didn't report. You don't report. People keep quiet and say, well, so if you are tolerating it by keeping quiet when you know it's being done near you, you take the blame, not the police.
Mrs. Pauline Talen, Minister of Women Affairs, decried the position of Nigeria as the third largest country after Egypt and Ethiopia with the highest number of FGM. Talen said despite laws and policies prohibiting the practice, some cultures see it as an integral part of them, hence the need for more enlightenment on the effects of FGM.
All well-meaning Nigerians, philanthropic organizations, the private sectors, sectoral partners, civil society organizations, faith-based organizations, men and boys, and the media not to relent in providing support for girls and women suffering from complications of FGM and all other forms of violence, abuse, and exploitation of women and girls, to enforce implementation of policies on ending this deadly act against female gender in our society.
Dr. Kabiru Atta, MSSFPO project manager in Nigeria, said they were working closely with health workers to stop the medical practice of FGM.
The idea is that you need to bring men and boys on board because this FGM is basically a cultural practice and the men are the custodians of culture, as we've seen. We need to work closely with the traditional religious leaders. You need to work closely with the young boys who will become men in the future and ensure that we are actually working in a partnership to end FGM by 2030.
For her part, Ms. Ola Mwela, UNFPA country representative to Nigeria, stressed the need to support women empowerment, gender equality, and the rights of women and children.
We remain committed to end FGM through our three transformative goals. We do implore the government at all levels to show action behind the commitment. A cut is a cut, doesn't matter who does it. We must stop the cut. We have to find a way where we move beyond that and stand together and speak with one voice.
NAN reports that several NGOs, CSOs, law enforcement agencies, religious and traditional leaders also pledged their commitment to end FGM practice and ensure perpetrators were prosecuted.